Hi everyone, I'm Vanessa. I'm the nurse practitioner at Fechner MD Plastic Surgery and Medical Spa. I am coming to you today with a video on the myths of Botox. I use Botox kind of as a coverall term because I think that's what most people associate with. There is 4 different neurotoxins on the market actually. There's Botox, Dysport, Xeomin, and Juvo. So these products are not the full active toxin, and I think that's important to know. They're actually a purified protein. So Clostridium botulinum is the bacteria, and then the botulinum toxin is the protein derived from it. So you can compare this to taking penicillin. It's derived from a bacteria, but you're not actually taking a bacteria. So they take a little piece out of the active ingredients that makes this work. Alright, so the goal is to use just enough to relax the muscle. It's very localized, it's not absorbed systemically, meaning it's not going to travel through your bloodstream and make you sick. People often will say to me, well, can I get botulism from this? Well, the truth is you would need probably 500 times the amount of what your normal dose would be. So there's really no risk of that actually happening. And for that to happen, you would actually have to be injecting the toxin itself. So remember, we're just using a purified protein. So that's important to know. All right, so another question. I don't want to look overdone. I don't want to look like one of those people on TV on the show Botched, or someone in Hollywood that's gone too far. All right, so that's fair enough, right? Nobody wants to look like that. There are tons of people who have these procedures done every day. And you would never even know it. And I think that is important, that you understand that if you go to the right injector, someone who really understands the anatomy and understands your goals, you shouldn't have to be worried about that. You know, you're always going to look like yourself, just a more refreshed version. It is not permanent. It lasts about 3.5 to 4 months. You're gonna see probably at the 3.5 month mark some of your movements coming back. My friend told me I need 20 units of Botox or Dysport because that's what she does. I hear this a lot. People come in and they kind of dictate their own dosing. Well, the thing is that you really need to understand how this works, and so it goes by the strength of your muscles. So your injector is going to do a good assessment and try to figure out how much you need to make your muscle relax. This may be a totally different number than your friend, your sister, your mother, because everybody's muscle strength and anatomy is a little bit different. So I understand a lot of times, you know, if you've never had it, it's nerve-wracking. You kind of go with what someone has told you, but I can promise to you that I will explain everything in the office and explain why I use certain doses, why I treat certain areas. Can I get Botox in my lips or under my eyes? So this is kind of an interesting question because it depends on what you're trying to achieve. There is a pretty significant difference between neurotoxins and dermal fillers. So dermal fillers are going to add volume. Neurotoxins are going to relax lines and wrinkles and smooth things out. You actually can use neurotoxins in a more advanced fashion in the lip, particularly in the upper lip. If you have vertical lines, these happen from smoking, pursing your lips, drinking from water bottles or straws, or you can use it for a lip flip. A lot of women today are not wanting to do fillers, but they're wanting to show a little bit more of the pink, and that's actually a great way to do it. Will I look worse after I do it and if I don't keep it up? This is one I hear often too. The answer is no. If you don't keep up with this, all that's going to happen is your muscles are going to come back to the movement they were when you started, but it's certainly not going to be worse by any means. Sidebar here, our office does offer a program because we we know that things kind of add up. We call it our VIB, which stands for Very Important Beauty. And what this is pay a small fee. It's an annual fee. You get 10% off of every treatment with myself, every treatment with our medical estheticians, and all skincare. So usually this will pay for itself in the first visit, and it's kind of a no-brainer. A little something about our office and how we really value your business. So thank you to all my patients. How young is too young to start, and how old is too old? This one comes up a lot too, because people will say to me, we don't need that stuff. And I mean, the truth is you want to start sooner than later. You're never too old, but the goal is to relax the muscle before that wrinkle comes. So if you start early, for say in your mid-20s, a small amount's going to go a long way. Does it hurt? Everyone wants to know this. Will I need to take time off? The answer is everybody's pain threshold is different, right? Mine's different than yours, and different than hers, and his. I think majority of people get through it without much discomfort. Some people come in and really, they're more anxious if they've never had it, and when we're done, they'll be like, oh, that's it? That's it. I tend to describe it kind of like little annoying mosquito bites. Like, you know they're happening, but they're just kind of like, blah. After you get treated, you'll have little blebs, again, look like mosquito bites, and those reabsorb in about 15-20 minutes, and no one will even know you were there. The needle we use is teeny tiny. It's actually so small you can't see the hole on the end of it, so you really shouldn't have much discomfort. I'm not going to have to take any time off from work because the injection sites are so tiny, and they're going to resolve in, like I said, 20 minutes. You could potentially have some bleeding or bruising. It's rare, but it can happen. No big deal. It resolves pretty quickly. Little arnica cream helps. We also have arnica tablets at the office if you're someone who, you bruise easily. So I think we kind of laid out that neurotoxins are actually really safe, and they're not permanent. They're just a fun treatment, and they make such a big difference. If there's anything you're going to start with in the aesthetic world and you're nervous, come in and get some Dysport. I will go through everything with you, explain it to you, and make you feel comfortable. I see everyone back at 2 weeks to make sure you are happy. Overall, just trust your injector, be very clear about what your goals and expectations are, and don't trust your face with just anyone. So come in and have it done right the first time. I hope that I answered any questions that you may have had about any myths or concerns with neurotoxins. I know this is a big topic, so I really hope that we addressed everything, and if we didn't, feel free to send me a message, and I'm happy to do a new video or answer you directly. We hope to see you at the office once we are seeing patients again. That's it. Please remember to go and follow Fechner MD on Facebook and Instagram, and we hope to see you soon.